All right, this is part 2 of chapter 21, skin and eye. So we're talking about the eye now. So this is going to be our conjunctivitis, the viruses and bacteria and just anything irritating to the eye, smoke or, chemicals that you're working with can cause conjunctivitis. So you probably know this as pink eye or red eye. And it's caused by a few bacteria, as you can see. Haemophilus influenzae is the most common. So this word, I know it has the word influenza in it, and that makes you think the flu. They named this bacteria influenza before they knew the true flu was caused by a virus. So it still has that name. But it's a bacteria, Haemophilus influenzae. Really, really common cause of this. Very, very contagious. Anytime you see someone with pink eye, it is contagious. It's contagious from eye to eye, and you treat it with antibiotics. So it's pretty common an infection. Maybe you had it in your life before. It's an acute infection. It's not long lasting. It's purulent, which means it makes a lot of pus, as you can see. So bacterial conjunctivitis is different from viral because of this pus. If you see a really thick pus produced, more likely than not is bacterial conjunctivitis. Right, so this is our, yellow discharge, green or white, and they become dry, crust over your eye, basically glue your eye shut sometimes. This is another eye infection called gonococcal ophthalmia neonatorum, and it is basically conjunctivitis passed through the birth canal. So that's where the neonatorum it comes from, ophthalmia for the eye, and gonococcal because it can be caused by Neisseria gonorrhea, which is the gonorrhea. This also causes so this is a sexually transmitted infection. Neisseria gonorrhea causes gonorrhea, but if it passes to the eye, it causes an eye infection. Specifically, this one, gonococcal ophthalmia neonatorum, is specifically referring to passing through the birth canal. You can see that conjunctivitis is also caused by chlamydia, trachomatis, that causes chlamydia. So if the mother has Neisseria gonorrhea or has chlamydia trachomatis in her birth canal when the child's being born, both of these can cause a severe kind of conjunctivitis in the baby. So because this was an issue, right, and pretty common, they would always treat with something called silver nitrate, and we talked about how silver was an antimicrobial metal, and they were routinely just given to all infants' eyes after birth, but it's now more common to do an antibacterial cream or drop, and then most hospitals are required to do this because it can cause really, really serious damage to the eyes, such as blindness. So that is severe. Our next one is called trachoma. So trachoma is not very common in the United States. So trachoma is a disease caused by chlamydia trachomatis. So trachoma comes from this term, okay? So it is this bacteria that also causes chlamydia. If you get into your eyes, it causes a really severe form of eye infection that can actually turn your eyelashes in, and then the eyelashes will poke your eye and really hurt. And so that can cause scarring, and it's also very, very painful. It can lead to blindness if it's not treated. And the sort of thing about trachoma is that it's preventable with just good hygiene, clean water, and just knowledge of, proper aseptic techniques. So it's usually found in areas that are very impoverished, places that do not have good clean water, and they also don't have a good health system. All right, so that's it for bacterial infections of the eye. We talked about the conjunctivitis. Keratitis, we talked not a whole lot, but just know that keratitis can also be caused by your staph epidermidis, Pseudomonas aeruginosa. That's the infection of the cornea, remember. Neonatal conjunctivitis, this is the one that we caused by chlamydia or Neisseria. And then trachoma was chlamydia trachomatis, right? The same one as here, causing this severe conjunctivitis. Whenever you see these charts, right, the disease and the pathogen and the signs and symptoms and transmission are things you could focus on. I will never ask you about what drugs are being used unless I specifically mention it. All right, let's talk about some viral infections of the skin. So we have our human papillomavirus, herpes simplex viruses 1 and 2, viral conjunctivitis, and herpes keratitis. So first one up is the group called Papillomaviridae. HPV, or human papillomavirus, is one of these viruses that causes warts on the skin. And so warts, the clinical name would be a papilloma, and they can occur anywhere on the body. So we have common warts, what they would just say is, on any skin of your body. Plantar specifically refers to the bottom of your feet. Flat warts and filiform warts and genital warts. Filiform warts are these guys, right? So they're going to look kind of, they're not going to be round and attached to the skin. They can come off the skin a little bit and they form like a fuzzy border. So that's your filiform wart. And warts are, there's 50 different kinds of this papillomavirus, right? So there's lots of different kinds that cause warts. So you can get warts all the time. So what happens with that is that the skin will be colonized by the viruses, and it can basically change and cause the skin to grow a lot. So the growth, basically the skin overgrows and forms that wart. Recent studies found that this virus can also augment the normal microbiota of your skin, which can lead to basically them taking over. So transmission, it is communicable. So you can get warts from someone else who has a wart by direct contact, including sexual contact, because genital warts is definitely something that this guy can produce. Infection, several weeks later, you're going to see the wart. And it's basically the skin growth caused by the virus. Usually it's harmless, right? They're kind of annoying, and there's topical treatment available over the counter for some warts, right? So let's think about the skin or genital warts. A lot of these viruses, when your body gets infected, you know that you have all these defenses for virally infected cells. So your immune system could be able to take care of many, many of these HPV viruses before they actually form a wart. Also, you can, after the wart is formed, the wart can go away because your immune system is eradicating the virus. If the wart's consistent or in a very uncomfortable position or on your body, they can be removed by other means, right? So cryotherapy is freezing, topical chemicals, you can burn them with acids, electrodesiccation and lasers would be done at the hospital. I guess cryotherapy as well, any of these. But electrodesiccation is using basically electricity, right? And lasers, the light, to get rid of those viruses in that wart. So these are various kinds of warts. Sorry for the gruesome picture, but these are all the different warts caused by human papillomavirus, and you can see that this is the genital form of the wart. All right, so because HPV causes this overgrowth in cells, overgrowth in cells is a cancer attribute, right? We know cancers are when cells lose their ability to stop dividing, they keep dividing, and they form a tumor. Then after the tumor, they could spread and can be very bad. So because they found a causal link, this word causal is really important because it showed definitively with lots of research that there is a link between an HPV infection and the rate of cervical cancer. So when this virus gets into the vagina, it also causes penile cancer. So the genital form of the wart can cause cancer. And over 99% of cervical cancers, when they look at it, right, they contain some kind of HPV DNA. So we can say that HPV causes the wide majority of our cervical cancers. Because of this, they created a vaccine. All right. So the world prevalence of HPV, and this is just it's so common to be infected with HPV that 9 and 13% of the world has HPV infection. And then most of them, you guys, are subclinical, meaning that there's no signs or symptoms of it. You have the virus, your body is basically fighting it off, and there's no progression to disease. And so when you say most HPV infections regress spontaneously, that means that your body has taken care of it. It's your immune system has won the war against the virus. And cervical cancer develops in a minority of women, right? So those women who are more susceptible to that infection. And it usually appears more than a decade after the initial infection. So it can just relate, it just stays dormant in your cells of the cervix for a very long time before it, can cause cancer. So I do want you to know Gardasil. Gardasil is a name of a vaccine that's going to protect against 4 HPV types that are the most prominent ones that cause cancer. So it will basically, be active against 70% of cervical cancers and 90% of genital warts. It's a subunit vaccine, right? So what do we know about subunit vaccines? It's just a piece of the virus that they give you in the vaccine so your immune system can react to that specific antigen, and in this case, 4 different antigens. So the other thing we know about subunit vaccines is they're not really great. The effectiveness is kind of low. So that's why they have you do it 3 injections over 6 months to really stimulate your immune system 3 times so that you can build up the antibodies and memory cells to the vaccine. And the recommendation is that you get this vaccine into kids before they become sexually active. So, girls 11 to 12, as young as 9, but also for boys. All right, our next one is going to be a herpes viridae, herpes simplex virus, or HSV. There is distinct types, HSV 1, 2, 3, and 4. We're going to just mention 1 and 2 here. So HSV is very common and it's also contagious, and the reservoir is in the general population. So people give it to other people. Any herpes virus that you have is going to have latency. It's going to stay in your cells for life, basically. And then it can cause those recurrent infections. So latency, remembers that it's just quiet. It does not produce any issues, no symptoms, no signs. It's just sitting there inside of your cells. And for whatever reason, right, there's some kind of stimulus, that a trigger that causes it to reform those virus particles and then basically cause an eruption. So HSV1 and HSV2 in general, okay, I'm going to say in general, HSV1 is more known to cause basically cold sores, so transmitted orally and also through respiratory routes. The majority of the population is thought to carry HSV1. Most of us are asymptomatic. Some of us will get cold sores. And one thing about the HSV1 and where it is latent is in something called the trigeminal nerve. I think I have a picture of this here. So you have this specific trigeminal nerve is a cranial nerve. It goes and it serves your face. And there's lots of branches of it there's a branch to the eye. There's a branch to the area around the nose, and there's also a branch to areas around the mouth. So HSV1, it lays dormant in basically like there's this area here where the cell neuron, so the neuron, right? The neuron has a cell body, has a really long axon, it has dendrites. So the virus will actually just live in the body, which is located here. It's not in the brain. It looks like it's in the brain. It's not. Okay, so but once a trigger, right? There's some kind of trigger. What can triggers be? They can be illness, right? You're feeling sick, you get a disease, sunburns can cause the virus to come out of latency, stress, poor health, even, fluctuations in hormones. So there's something going on that triggers the virus to come out, and it can travel along any of those branches. Okay, it can travel the branch to the eye and cause ocular herpes. It can travel to around the nose and cause those breakouts around the nose, and it can also cause those cold sores, or also known as fever blisters, around the mouth. So depending on which branch it took, that you're going to see the herpes lesion in that area. Okay, a thing to know about herpes is that the virions can be transmitted before your symptoms. So the virus can be maybe in the skin around your mouth, in the lips, for a while before it actually starts to produce that sore. And it can be transmitted before you have a sore. Because the virus, these herpes viruses, are going to be found inside of your neuron bodies, there's no way you can't kill the neuron, right? Because neurons are really important. So there's no cure because that virus has taken up residency in your neuron. But it can be treated with antivirals. So things that would, stop the virus from replicating inside the cell, or just like keep it latent for longer. You can also see we have a couple other words here. So genital herpes, same thing, HSV2. Okay, so let me just say this, HSV1, which is normally here and transmitted to the mouth, and HSV2, which is more of a genital infection, right? A sexual STI, sexually transmitted infection. They are going to be same. It's going to be inside a neuron, but the neurons they kind of live in are down here. So the nerves are going to basically serve the genital region, right? And that's why we call it genital herpes. If the herpes infection gets to your fingers, and a lot of times this is a health worker issue, Whitlow's will appear, which is basically that herpes infection coming on the finger, and the herpes infection can actually travel up your nerve and then basically live here. Okay, so once you get infected with herpes, it does lay dormant in your body, and hopefully like you never see it again, but every once in a while you might get a breakout, and the antivirals will help to limit those breakouts. So again, HSV2 is usually transmitted by sexual contact. It lives near the base of the spine, and it causes genital herpes. And then this is the rare occasion, right? So anything that's kind of in your body, if it's able to spread, it could spread to the brain and cause something called herpes encephalitis. This is a very deadly form of herpes, 70% mortality rate. Okay, so these are just some images of the cold sore or fever blister and genital herpes. Okay, so these are the other parts, right? So ocular herpes, we can see there's some around the eye. This is a Whitlow. So this is, again, an occupational exposure afflicted with people who work with patients that might have herpes outbreak or even before the outbreak, right? So it looks very painful. And then herpes keratitis. So this is lucky. They didn't get the branch that goes to the eye itself, but this is just around the skin. But keratitis is where the cornea is actually affected. You can see that cloudiness of the cornea. This can lead to blindness. So herpes keratitis is pretty severe. Can you get an HHV? So HHV is the same thing as HSV. I was using a textbook that used HHV for a second. Human herpes virus, or herpes simplex virus. The HH stands for human herpes. Can you get HSV1 infection in the genital area? Yes, you can. Okay, so they're not limited to, HSV1 is not limited to cold sores. It's not limited to your mouth and head. The virus doesn't know where it is on your body. So if you get HSV1 in the genital region, yes, you can have HSV1 in the genital region. It will still manifest as genital herpes, but it's the other type. Can you transmit herpes without fever blisters? Yes, you can, right? All right, so viral conjunctivitis, again, we saw bacterial conjunctivitis as giving this sign of very thick pus formation, yellow, very sticky. Viral conjunctivitis is usually absent of that pus. So viral conjunctivitis is going to have red and itchy eyes. It's very highly contagious. You can pass it from one eye to another, but usually absent with the pus. So the viral form will resolve on its own. The bacterial form you need antibiotics for. And then here's our overview of the viral infections. Again, don't worry about the ones I did not star. And then we're into the fungal infections. So I'm going to take a break here.